Welcome to our Infectious Disease and Pregnancy virtual podcast. Today's specified topic is on the infamous coronavirus, COVID-19. My name is Darian. I'm a student midwife. I attend Midwives College of Utah from Detroit, Michigan, and me and my friends are excited to be here dropping some gems for you all about, something a very important topic. And here they are.
Hi, I'm LaPortia, live in Arizona. I also go to NCU as a student. This is going to be exciting. This topic is really heavy for me because I've unfortunately experienced COVID with pneumonia, almost died in 2021. I know I wasn't pregnant, but I feel like this topic is really important for our pregnant mamas.
Thank you.
And I'm Tahira, also an MCU student, and I am in Inglewood in Los Angeles, California.
Inglewood.
I gotta come see y'all soon. We gotta make sure we link, that'd be fun.
Yeah, we have the best weather, so come here.
Okay. We'll do. We'll do. So yeah, just jumping right in. We just want to share some really important information that is evidence-based with you all, so that way you can care for yourselves, your peers, and your community. With that being said, coronavirus. Let's get into it. Coronavirus disease of 2019 is caused by a severe acute respiratory syndrome, coronavirus 2, also known as SARS-CoV-2. So you may hear me say COVID-19 or SARS-CoV-2 interchangeably. They're basically the same thing. One version is more severe than the other. Um, it was a global pandemic back in March of 2020, and there are a couple different strands out there depending on where you are located geographically. With that being said, most cases, as we know, are mild, 80%, but they can become severe very quickly. That is 15% of all cases, and can also be critical, requiring ventilation, which is about 5% of the infected population. So why is this so important? Why are we here talking about this today? About, COVID-19 and pregnancy. Well, because pregnant people and infants are particularly disproportionately vulnerable and susceptible to COVID-19 because of the physiological changes of pregnancy, and the environment, the the cardiorespiratory and immune systems, which are all altered, during pregnancy. They can be um, worsened or affected by SARS-CoV infection in pregnancy. And what does that mean for baby? Well, fetuses may be exposed to SARS-CoV-2 during a critical period of fetal development, which can affect their growth and development. Findings suggest that SARS-CoV-2 infection was associated with preterm birth, stillbirth, and low birth weight. And lastly, NICU admission, but it was not necessarily disproportionately associated with cesarean section deliveries. Studies have also shown COVID-19 in pregnancy is associated with preeclampsia, gestational diabetes, again, preterm birth, and that severe COVID-19 can lead to considerable maternal and neonatal morbidity. Now, the nature of the specific association between COVID-19 and pregnancy outcomes still remain unclear. So a lot of more studies are, doing the work, taking on the task of giving us real data, real facts, and in clinical settings.
So let's talk about some symptoms and when you should be reaching out to your medical provider. So COVID-19 has some symptoms that can range from very mild to more severe, and some people just may not have any symptoms. So some common symptoms that you might have is including like fever or chills, cough, shortness of breath, fatigue, some body aches, some headaches or some migraines, a sore throat, and sometimes like a loss of taste and smell could also be a symptom, and just some experience some nausea, some diarrhea, or vomiting. Most pregnant people with COVID-19 will have like mild symptoms and can recover at home. But however, it's really important to just contact your healthcare provider if you test positive or develop a fever or notice your symptoms are getting worse. You should always seek emergencies care right away if you're having trouble breathing, you're having chest pains, you're confused or like having like hallucinations, your bluish lips or face, or if you notice some decrease in fetal movement. So just always listen to your body and just reach out early. That way we could be able to help both you and your baby be safe. Now, some of the risk factors and some preventions for COVID-19 are just some pregnant people. They have a higher risk of severe illness from COVID-19. This includes those with conditions like obesity, diabetes, high blood pressure, asthma, heart disease, or a weakening immune system. Some pregnant individuals who are older or have limited access to healthcare may also be facing some increased risk. But the good news is, ha ha ha, there are effective ways to prevent COVID-19. So I think the biggest one is like being vaccinated. Um, some research says that vaccination is the most important step, and is strongly recommended during pregnancy. Studies also shows that COVID-19 vaccines are safe for pregnant people and can also protect newborns. Other prevention strategies include like just making sure you're washing your hands daily or often, avoiding close contacts with other people that are sick. If you know you're going to be in like a high risk setting, or like a crowd, always wear a mask. And then just improving your ventilation indoors. So like having a air humidifier to help you. And just taking these steps can significantly reduce your infections and help support a healthy pregnancy. Now, for those that are not vaccine savvy and you're more of a herbal person, I would say just try to intake more of your vitamins, like your prenatals, your high C, vitamin high C. All of those things could like help you naturally if that's the route that you want to go. Just up to, increasing your herbal intakes to prevent.
And just want to add one important, step in there that's so simple that we don't always think about, but washing your hands, just keeping your hands washed. Um, we was washing our hands for 30 seconds every hour on the clock, when we were heavy in the pandemic, but those
Yep.
practices are still very important.
Mm-hmm. Yep. Hand sanitizer, all of that. Carry it with you. The spray kind and the bottle kind, whatever you want.
Those masks too in public places.
My mom was so creative around that time. She was like creating masks, like, cause she does like embroidery things. So she was literally selling masks. Like she was banging around COVID time. So,
Yeah, I remember all the mask fashion around that time
mm-hmm.
and
Yeah.
matching them to outfits and everything.
Yeah, we don't ever take things serious when things are supposed to be serious, right? We was making a fashion statement out of everything, even through a pandemic.
I have to go find my cute ones because we're masking at the office again because everybody's sick. So,
Uh-huh. And also just remember like sometimes like the symptoms sometimes lead to like flu symptoms. So if you feel like you're catching those flu symptoms and you're not really sure if it's a flu or COVID-19, always just call your healthcare provider and get tested.
yeah, and speaking of testing,
Mm.
so there are multiple methods of testing, and they also, I found when I was researching this, have tests now that can detect whether you have flu or COVID, that you can get in the at-home test, like in your local pharmacy. So when it comes to testing for COVID-19, there are PCR tests, which is the polymerase chain reaction test, and that is looking for genetic material of the SARS-CoV-2 virus. And those are considered the most accurate. So that has a very high accuracy rate, especially if you're very early in infection or not having symptoms, because it is really sensitive. So those ones are usually done at clinics. So most likely, if you wanted a PCR test, you would go to your doctor or local clinic or urgent care or whatever. But they do have some PCR tests that you can buy yourself in the pharmacy. And then there are also the rapid antigen tests, and those are looking for proteins or antigens on the surface of the virus. And those are less sensitive than the PCR test, especially in early infection or without symptoms. And they have really quick results that you can see at home. So, testing is widely available and easily accessible. And when it comes to treatment, the information around treatment is a little bit less, a little more complicated. So, when we talk about COVID-19 treatment and pregnancy, the research is, I'll say, uneven. The most commonly prescribed medication is Paxlovid, but that has not been studied directly in pregnant people. And because pregnant people are often excluded from clinical trials, the guidance varies depending on what source you are looking at. So I'm going to go over a brief summary of what we know, what we don't know, and how decisions are currently being made. Um, when I looked at the National Institute of Health, their treatment guidelines, they specifically recognize the uncertainty of Paxlovid treatment in pregnancy, and they emphasize shared decision making. So their direct quote says, given the possible benefit and residual uncertainty regarding potential undesirable effects, clinicians should engage in pregnant or breastfeeding individuals in fully informed shared decision making regarding the use of Paxlovid, which the official name of is nirmatrelvir and ritonavir, but we're just going to call it Paxlovid because that is how it's branded. So that's the National Health Organization, the National Institute of Health. And they said maybe, basically. And then I went to ACOG, the American College of Obstetricians and Gynecologists, and they specifically named Paxlovid as the preferred outpatient treatment for mild to moderate COVID and people with high risk of progression to severe disease. And they do recommend it in pregnancy. And they note that high risk groups include pregnant people, people with cardiac and pulmonary disease, immunocompromised people, and also under vaccinated and unvaccinated people. So ACOG has a very clear position on it that says that pregnancy is non-exclusion for using Paxlovid and that it's safe to use in pregnant and lactating patients. They also note that it is really underutilized in pregnant people because there is uncertainty of the vaccine amongst pregnant people. So a lot of them choose not to take, not the vaccine, sorry, the treatment in pregnant people. So a lot of them choose not to take it, which also impacts the limited data on Paxlovid use in pregnancy. So ACOG recommends it. Recommends it. The National Institute of Health says maybe. And then I also looked at Paxlovid's direct website. So I went to the manufacturer website, and their official statement of the primary treatment of COVID says it is, quote, it is not known if Paxlovid is safe to use during pregnancy. So be sure to tell your healthcare professional if you're pregnant or have been pregnant within the last few months. So with that said, I don't know if I have a clear recommendation on treatment in pregnancy. I think that pregnant people are being asked to make decisions about treatment without complete data. But at the same time, they face a higher risk of severe COVID or having COVID because of the immune compromised state or immunosuppressed state of pregnancy. So this makes your decision making really important. Talking about clients, about their values, clearly explaining the benefits and unknown risks, and avoiding pressuring them in either direction. So, sorry I couldn't give you a more straightforward answer on treatment in pregnancy because to me, the science is still, we don't know.
Wow, thank you, Tahira. That was great. And you too, LaPortia. Y'all dropped some really great gems today for our viewers, for our audience. I'm very, very, very excited for the folks. Thank you all very much. And to the viewers and to the listeners, I hope you all was able to, gain something from this discussion today. And let us know, in the comments or wherever you may have seen this video, if you would like to see more of these, educational virtual podcast videos. As future midwives, there is so much we could talk about. But thank you all for listening. Have a great and lovely rest of the year.